and welcome to an India Today special broadcast that comes to you from the heart of the national capital. I'm Gaurav Sawant, and today on the show, you will come face to face with the front line of India's corona warriors. Those healthcare professionals, doctors, nurses, technicians, and others who are treating coronavirus patients. They're risking their lives. They're not interacting with their family members. They've put India first, and I will get you their story and contrast their story with those members of the Tablighi Jamaat who are creating trouble, fomenting trouble even at the quarantine centers. For example, some who stand accused of defecating and urinating at these quarantine centers.
After endangering thousands, Jamaatis in quarantine continue to misbehave. After roaming semi-naked and making vulgar gestures, now they defecate inside a quarantine center. Jamaatis also throwing tantrums at the police. A few of them are even demanding biryani. Some have even tried to flee from isolation. Over 25,000 Jamaatis quarantined. India's biggest contact tracing exercise. The top focus on India first.
And on the broadcast, I will get you details of India's biggest contact tracing exercise that's currently underway, because some of the Jamaatis are still not coming forward to help ensure that in case they're affected, they're identified, isolated and treated, they're a risk to themselves, they may well be a risk to others. Let me now get you details of the big picture as far as India's war on coronavirus is concerned, and watch these numbers very carefully, because in the detail, there is the big picture. So let me now get you details. Total confirmed cases in India as on 9 p.m. today are 4,789 cases. 124 people in India have lost their lives. But look at the bigger picture. 124 may have lost their lives, but more than double have recovered. 353 people have recovered, according to Health Ministry. So it's very, very important that you stay positive, get treated, and come out of this on top of the situation. So the government has made it very clear. The centre and the states have to be on the same page. The centre and the states have to combat coronavirus together in India, and the people have to come together. So what are the top developments across the country? The Health Ministry has cleared the air on the use of hydroxychloroquine. The Health Ministry has said India has sufficient stocks of hydroxychloroquine. It will only be used to protect healthcare officials and caregivers.
SCQ एक पर्टिकुलर केस में ही, दैट इज क्रिटिकल पेशेंट्स एज वेल एज जो उनको हेल्थ वर्कर्स है उनको दी जाएगी. उसके लिए जो भी रिक्वायरमेंट आज देश की है उसके ऊपर ऑलरेडी फार्मा मिनिस्ट्री प्रॉपरली उसको एनालाइज कर चुकी है. उसके तहत वो प्रोडक्शन को भी मॉनिटर कर रही हैं, और हम लोग, आई कैन एश्योर यू, वी हैव सफिशिएंट क्वांटिटीज एज फार एज मैनेजमेंट.
Hospitals in India have been divided into 3 categories by the Health Ministry. The first category is COVID care centers, and that is for mild cases or suspected cases. The second category has centers with dedicated blocks and wards for coronavirus confirmed patients, and the third category is for dedicated hospitals which will also have ventilator support for critical patients.
को मैनेज करने के लिए डेडिकेटेड फैसिलिटीज को 3 भाग में बांटा है. पहली फैसिलिटी को, जिसको हम कहते हैं कि कोविड केयर सेंटर, जहां पर प्राइमरीली माइल्ड या वेरी माइल्ड और सस्पेक्ट केसेस को रखा जाएगा. सेकेंड टाइप ऑफ सेंटर्स आर डेडिकेटेड कोविड हेल्थ सेंटर. इससे पहले मैंने बताया था दे आर केयर सेंटर, दीज आर हेल्थ सेंटर्स. और इन सेंटर्स में उस टाइप के पेशेंट जो कि क्लिनिकली मॉडरेट लेवल ऑफ सीरियसनेस है उनको मॉनिटर किया जाएगा. तीसरा टाइप ऑफ क्लासिफिकेशन इज डेडिकेटेड कोविड हॉस्पिटल्स. दीज आर द हॉस्पिटल्स जो कि कॉम्प्रिहेंसिव केयर प्राइमरी प्रोवाइड करेंगे, जो कि हमारे सीवियर और क्रिटिकल केसेस हैं. ये हॉस्पिटल भी या तो फुल हॉस्पिटल हो या डेडिकेटेड ब्लॉक्स हो और इनमें फुली इक्विप्ड आईसीयू फैसिलिटीज, वेंटिलेटर और बेड्स विद एश्योर्ड ऑक्सीजन सपोर्ट होना चाहिए।
The University Grants Commission has constituted a 7-member committee to discuss the issue related to examination and academic year in view of emerging situation due to COVID-19. The committee is set to submit its report on the 30th of April. WhatsApp is imposing additional restrictions on how frequently can a message now be shared. This is WhatsApp's latest efforts to curtail the spread of misinformation about coronavirus. "167 people in Noida adjoining Delhi with a travel history overseas are missing. The health department have said that they haven't found the addresses as given documentation. The search is still on. Noida is currently the worst hit district in Uttar Pradesh with 58 active cases. Odisha records its first coronavirus death. A 72-year-old man from Jharpada died in Bhubaneswar. The state has 18 coronavirus active cases so far. And there's breaking news coming in. The Delhi government has given a list of more than 1,900 members of the Tablighi Jamaat to the Delhi police. And this is a big list that's been given out. The Delhi police wants to know where were these people, who all were they in touch with. And the Delhi police will be using scientific forensic methods to trace their movement, including through their mobile phones. The Delhi government and the Delhi police extremely worried because these members of the Tablighi Jamaat, they are not forthcoming with information, and there is fear that through them coronavirus could spread to localities in Delhi and maybe even beyond Delhi. I quickly want to cut across to India Today's Aishwarya Paliwal for more on this big story. Aishwarya, bring us details of this huge list that the Delhi government has now handed over to the Delhi police.
Well, Gaurav, let me start by telling you, we are seeing that the Delhi government has been taking this on war footing. We understand that the Chief Minister is personally monitoring every move. And now there is a list. Let me tell you the exact number of the people whose mobile phones have been given is 1,950. Let that sink in. That's the number that the government has given to the police, and now the police is making sure that they trace all these people, because at the moment the biggest fear is that these people or most of these people could turn out to be positive. They are potential carriers, and that's what the government wants to figure out, and also they want to do a real-time tracing of everyone who these people met.
Aishwarya, for the moment, many thanks for joining me. It's not just the Tablighis who are missing. It's not just members of the Jamaat who may now be in quarantine centers. They're not forthcoming with information. There is a bigger concern. Some members of the Tablighi Jamaat, those who attended the Markaz at Nizamuddin, they're misbehaving. They're not behaving themselves even in quarantine centers. And this complaint hasn't just come from one quarantine center. Remember the complaint that came from Ghaziabad? Now there's another complaint that's coming from the national capital, where quarantine center staff have made a written complaint to the police saying that some members of the Jamaat, they defecated in the corridor, they urinated in the corridor, they're not observing quarantine rules. And this could lead to a bigger potential problem even at the quarantine center.
Members of the Tablighi Jamaat have emerged as single largest spreader of the virus in India. The Tablighi super spreaders have so far infected 1,500 people across India. They have also been accused of ill-treating health workers, roaming around nude and making vulgar gestures at nurses, And now to add to the virus crisis, some Jamaatis have now tried fleeing from quarantine. A group of Jamaatis have allegedly defecated in front of a room at a quarantine center in Delhi's Narela. The accused, resident of Barabanki in Uttar Pradesh, had attended the religious congregation held last month at Nizamuddin. Delhi police have now registered an FIR against the offenders.
कई सारी ऐसी घटनाएं सामने आ रही जिसमें जो जमाती है वो एक तरह से कहा जाए कि कानून का पालन नहीं कर रहे हैं और कहीं ना कहीं गंदी हरकतें कर रहे हैं, जिसको लेकर अब इस मामले में एफआईआर दर्ज हुई है। पुलिस मामले की जांच कर रही है, कई लेवल पर इस पूरे मामले की इन्वेस्टिगेशन की जा रही है।
Delhi police meanwhile launched a probe into Tablighi Jamaat funding. All bank accounts linked to Jamaat are under scanner. Cops also served the second notice to Tablighi Jamaat chief Maulana Saad, who is in hiding. He has been asked to furnish details about the Tabligh meet.
What we have been given to understand is that as of now this is being treated as a crime scene. As far as the investigation is concerned, they have to take many precautions. Maulana Saad is not arrested, but even if they have to go inside for the purpose of investigation, they have to take all precautions.
In Uttar Pradesh's Baghpat, a COVID-19 positive man from Nepal was apprehended after he fled from the community health center after breaking a window pane.
उस पर पूरी टीम ने तत्परता से वहां पहुंचे तो पता चला ये वही है और खुद उसने कन्फेस किया कि कैसे ऐसे भागा है.
While cops and healthcare workers endangered their lives, some Jamaatis continued their theatrics. In Uttar Pradesh's Rampur, some Jamaatis allegedly demanded biryani in quarantine.
चिकन बिरयानी और बिरयानी या इस तरह की चीज़ें डिमांड कर रहे हैं, मोस्टली नॉन वेजिटेरियन चीज़ें। ऐसे समय में इस तरह की फरमाइशें करना अपने आप में एक अपराध समान है।
Haryana has asked all Tablighi Jamaat members to disclose their links to the Nizamuddin event and travel details by 5 p.m. on Wednesday. Mumbai police have registered an FIR against 150 people linked to the Jamaat. Cases against Jamaatis have been registered in Uttarakhand, Uttar Pradesh and other states for hiding their travel details. Till now, more than 25,500 Tablighi Jamaat members and their contacts have been quarantined in the country. With Chirag Goti, Munish Pandey, Bureau Report, India Today.
They put themselves in harm's way to cure you and I and people across our country. Doctors, nurses, healthcare professionals, they know the risks they are taking, but they've taken an oath. They've taken an oath to give life, to cure people, and they're doing this. Now, look at the risks involved. There's a risk to themselves, there's a risk to their families, but their aim is to cure patients, and these are India's frontline corona warriors. I had the privilege and the honor of interacting with some of them at the Lady Harding Medical College in the national capital, a frontline COVID-19 hospital. This is the story of the COVID-19 warriors. Dr. Archana dons the PPE or personal protection equipment with a silent prayer on her lips. A resident doctor at the prestigious Lady Harding Medical College in Delhi, she is a part of a team of specialist healthcare professionals testing COVID-19 cases.
We are all working at the COVID lab in LHMC. We're standing outside the lab. We're working hard. We are working in shifts. We're working long hours, but we are motivated. And we're doing well here and handling all the load.
For more than 6 to 8 hours after donning the much in demand and available in restricted numbers PPE, healthcare professionals neither eat nor drink, nor do they even go to the toilet.
PPE पहनने के बाद ना कुछ खा सकते हैं, ना कुछ पी सकते हैं, केवल हम पेशेंट का वेट करते हैं और पेशेंट की सेवा के लिए सब कुछ करते हैं.
In fact, even after ending a shift, which may extend way beyond 10 hours, there are specific protocols to be followed before they are able to meet their family or loved ones.
once we are in the protective gear, we are safe, but still there is always a risk of exposure. So whenever I go home, I have to got two daughters. So usually they used to come, and whenever I used to open the door, they used to come and hug me. But now I tell my wife to hold them back. I just open the door with my elbow, don't even ring the bell. Then I directly go to the washroom, change my clothes, take a bath, and after proper washing, then I go and talk to them and hug them.
With a steady rise in COVID-19 cases, doctors realize the personal protection equipment are the protective shield in the long war against COVID-19. For doctors and healthcare professionals, it's an uphill battle in the war against COVID-19. The challenges are many: to protect patients, to protect themselves, to protect their loved ones, and also ensure that the personal protection equipment, the PPE, a scarce commodity, is utilized to the fullest. Why? Because in this battle, the war may still be ahead. With cameraman Ravikant in Delhi, Gaurav Sawant for India Today. And let me now cut across to Dr. N.N. Mathur, the director of Lady Hardinge Medical College, who joins us on India First. Doctor, it's a privilege having you on the show. How many tests, COVID-19 tests, have been carried out so far? What are the results and what does that indicate, sir?
So we have done around 1,300 tests so far, and around 70 odd have been positive in that. And our lab was one of the first labs to start in the city doing this test. It was established on a war footing within a span of 7 days, and it has conducted large number of tests.
Okay. Now, there was a reported spike. What explains the spike, and is there a cause for grave concern, sir?
Well, there was last week lot of tests came positive because of probably that Nizamuddin factor, and so that was one spike that we definitely saw, epidemiologically speaking. Otherwise, the things are quite as per expectation and well under control.
Is there a shortage of personal protection equipment? Is that a cause for grave concern? What are the risks that healthcare professionals are taking at this point of time, sir?
So Gaurav, the doctors are doing commendable job. They are our frontline soldiers, and both not only the doctors, but the nurses, the healthcare workers, and even the Safai Karmcharis who are in the forefront. They are designated at different places and categorized, and for each designated place, as per their category, the instructions have been issued as to what PPEs or what protective gear they will be wearing. These vary depending on the nature of the duty, and if you are working in the lab, then you will totally wear complete PPE and the suit, and if you are working and taking the samples, then again you will be wearing the PPEs, and if you are in the COVID ward, of course you have to wear the complete PPEs. So they are well protected, and we have, as we speak today, we have enough supply for all the PPEs, and although it's a constant challenge and every day we have to make effort, but we have a comfortable supply as we speak.
Okay, this indeed is a long war ahead, but there's another very important aspect, sir. Doctors, other healthcare professionals, nurses or lab staff or drivers or other people, do they go back home? Is it safe for them to go back home now? And God forbid, should the numbers spike in the times to come?
So, Gaurav, our doctors and nurses and healthcare workers had been going home or to the hostel till now, and because they are well protected, and only if there is a breach in their protection or in the protective gear, that we may put them under surveillance. But if they had been taking care and they had been wearing the protective gear, be it the PPEs or whatever was required for that particular job, then they can go back home, as this was the policy till now. However, we are working on the possibility of putting all the healthcare personnel into a hotel. The things will materialize in days to come.
Dr. Mathur, for the moment, many thanks for joining me. Proud of your entire team of healthcare professionals and those across the length and breadth of our country who are protecting our people, risking their own lives and the safety of their families. Very proud of you, sir. Also very proud of our braves who've made the supreme sacrifice of their lives, protecting our country from the virus of Pakistan's state-sponsored terror at the line of control. Remember, India Today, we at India First, we got you that story of how 5 of our braves of the special forces, they'd engaged with Pakistani terrorists who were infiltrating at the line of control in North Kashmir, in the Kupwara sector. The nation paid respect to our braves today. We sign off. We can never say thank you enough to our braves and to their families. Jai Hind, Jai Bharat.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.